Namaste. I am Dr. Manaan Gandhi from Dr. Gandhi's Ayurveda, and today we're going to discuss diabetes. Diabetes is a complex metabolic disorder, often trivialized and compared to mere blood sugar. Blood sugar levels, or even urine sugar levels for that matter, are simply a way to predict at what level this metabolic disorder may have reached. People abuse this. This is probably one of the most abused facts that is used in the market today. You will have a lot of companies coming in reducing your blood sugar. You will have a lot of therapies reducing your blood sugar level. In fact, you will have a lot of marketing going on how you can reduce blood sugar levels. But guess what? I have news for you. Blood sugar levels are merely the only indicator known to humankind as of now, obviously along with urine sugar levels, that can merely predict where diabetes is at the moment. It does not indicate the level of diabetes accurately, which means, and I'll give you a very simple example. If you are the king of a kingdom and there's a war happening at the border, a messenger would daily come and tell you that, listen, 100 of our men died and 100 of their men died. But if you were to pay the messenger and ask him to tell the king that only 15 of our men died while 200 of their men died, the king would be really happy, wouldn't he? You're the king. Reducing blood sugar levels by consuming or having things that are very bitter in nature, or reducing blood sugar levels by not eating food, by fasting, or by having various kind of bitter leaves, is merely masking the problem, because eventually diabetes is a metabolic disorder, which means that if you see low sugar levels does not mean that your diabetes is reducing. This is just a means of manipulating the sugar levels, and they by no means gives you a long-term result. So then what do people do? All you can do is control sugar, because not medically but statistically it has been proved that if you keep your sugar levels under control, the chances of you getting a diabetic complication is lesser. Understand, diabetes does not harm the body by itself. It's basically a silent killer, because it starts ruining the other organs of the body, and these organs that are being ruined because of diabetes start causing problems. So diabetic complication is what bothers you, not diabetes by itself. Which means that the allopaths will control your sugar, will keep it under control, will keep it under check using medicines to temporarily alleviate the problem or to delay the problem. But you cannot avoid the problem completely using this method. So then there is an entire pathy of control, but there's no one who's actually curing or actually attempting to remove the problem from its root. I'm repeating for the third time in this video, it is a metabolic disorder, which means that it depends on your entire lifestyle if you need to cure it. And Ayurveda understands and works on this. There are 4 factors that we normally talk about when it comes to diabetes. Of course, medicine, diet, exercise, and stress. These are the 4 factors. Medicines we've spoken about. There are Ayurvedic medicines. Again, not the ones that is, everything bitter crammed into one. There are Karela, Methi Dana, Jambu Beej, that just merely suppresses the blood sugar, doesn't actually work on diabetes at all. But there are medicines that will really lower not just your blood sugar, but your diabetes as well. Then there is diet, exercise, and stress. So medicines, diet, exercise, and stress form this holy quad, which when worked upon reduces diabetes. Why does diabetes happen in the first place? So there is a sutra in Charak Samhita, which is a foundation book of Ayurveda, which mentions this, and I'm going to read it out to you. Asya sukham swapna sukham dadhini gramya udaka anuparasa payasam navanna panam guda vaikrutam prameha kafakucha sarvam. Ignore the Sanskrit, I'll explain all of these things. Asya sukham, which means if you're sitting for a long time during the day and you're not active. Swapna sukham is if you're sleeping during the daytime. Dadhini means curd. So the first food product that actually causes and increases diabetes, not blood sugar, is curd. So we very highly recommend to not consume curd in curd products like chas, lassi, kadhi, etc. if you are a diabetic. Gramya Udaka Anuparasa Payasam, which means to have animals or birds that by nature are grown or live in a very marshy land. Payas is doodh, which means milk. So having milk also causes and increases diabetes. Not blood sugar, diabetes. Navannapanam, and this is very important. Freshly harvested grains that are not aged, that are not old, if they are consumed, they will also cause or increase diabetes either in a non-diabetic or in a diabetic patient respectively. And Gudavaikrutam, which means jaggery and things that are made out of jaggery. So things like molasses, brown sugar, refined sugar, all of these things will cause or increase diabetes. But that's not all. Diabetes, prameha, kapha krucha sarvam. Sarva means everything that increases kapha in the body or anything that gives you a cold. Now whether it's sleeping in the AC, whether it's drying your hair under the fan, whether it's having things like bananas, guavas, grapes, sugarcane, sitafal, lychee, fresh coconut water, or anything that causes a cold to you will increase diabetes. So all of these things have to be avoided when we're talking about diet. A lot of times we only take into account diet that influences blood sugar, because what has happened is that because blood sugar is the only way we can find out where diabetes might be, we always feel managing blood sugar is the only way of managing diabetes. However, you must have seen multiple cases where people who have sugars in the range of 500s have no diabetic complications, and people who've controlled their blood sugar to the T, who don't have blood sugar going above 100 at all with medication, end up having multiple complications. Because I repeat for the fourth time in this video, diabetes and blood sugar are different. So in Ayurveda, not just for blood sugar but for diabetes, there's actually something that can be done. And I've been blessed to have won a national level award for this. But there is something that is possible. And I feel that Ayurveda should be something that every diabetic must look at. Also, this entire treatment has to be holistic. It cannot merely rely on chemicals being pumped into the body to control blood sugar, hoping with fingers crossed that you don't get a complication. This has to be holistic. All factors must be taken into account. Although there are many medicines that do reduce blood sugar, there are actually good medicines that reduce diabetes as a metabolic disorder. And we've had a lot of patients and we've had very good success in regards to diabetes. While also you need to understand that in diabetes, the doctor's role is not as much as the patient's role. It's a holistic lifestyle care that is required. So this is Dr. Manaan Gandhi signing off. You can like, subscribe, and if you find that there's any value to these videos, you can share them with your family and friends. And if you need to reach out to me directly, you can just comment and I'll try to be there as much as possible. This is Dr. Manaan Gandhi. Namaste.